Hello and welcome everybody to this webinar on the economics of obesity entitled Saving Lives and Saving Resources. It's a great pleasure to be here. If we could have the next slide, please. My name's John Wilding. I'm currently president of the World Obesity Federation. I'm based in Liverpool in the United Kingdom, where I practice medicine, including care of people with obesity as an integral part of my practice. This is a really important topic that we're going to talk about today, and I do hope that you're all going to learn a lot from our expert speakers and our expert panelists. Next slide, please. Just a few housekeeping points before we start. Firstly, the webinar is being recorded and you can use the Q&A function to post comments and questions, and I will do my best to moderate the questions to the first part of the webinar, and Joanna Ralston from World Obesity will moderate the second part. There will be a chance to ask questions after each speaker, and there will be availability of the recording and the slides for anybody who's interested after the webinar has finished. Next slide, please. So this is our agenda for today. We're just in the middle of the welcome and introduction, and we're going to hear the headline findings of our paper, which was published in British Medical Journal Public Health from Rachel Nugent from RTI International. And then we will have the opportunity to ask Rachel some questions. We then have the majority of the time is going to be spent on panel discussion, and we have some real experts with us who are going to discuss the policy implications and national actions that might come from this work. And you can see the names of our experts there, and this includes people with expertise on policy from around the world, including and also Sarah Lebrock from the European Council of People with Obesity. So we do really have an excellent expert panel. I'm sure we will have an excellent discussion, and then Joanna Ralston from World Obesity will close the meeting off at 4 o'clock. So without further ado, it gives me, if we just move on to the next slide, please, sorry. Just to remind you a little bit about what we're talking about today. We're talking about the economic impact of obesity, and this is a partnership between the World Obesity Federation and RTI International. And this comes from a real need to provide better and improved economic evidence about overweight and obesity from around the world, not just from the developed world. And we want to use this work as a catalyst for change, making joined up policies which recognize and address the underlying root causes of obesity and not just treating the symptoms. Next slide, please. The paper was published a few days ago, as I've said, in British Medical Journal Public Health, and you can see how this has led to a fantastic media response, a lot of interest in the costs of obesity. But what we have to remember is that if we maybe spend a little bit of money now, we really will save lives and costs in the future. So that is really the message that I want people to, one of the messages that I want people to go away with once we finish the discussion today. So without further ado, if we can move on to the next slide, please. It gives me great pleasure to introduce Professor Rachel Nugent, who's an associate affiliate professor of global health at the University of Washington and works also for RTI International, and who has been instrumental in helping us put this important report together. And she's going to describe the headline findings of the work. Over to you, Rachel.
Great, John. Thank you very much. And I first want to say that myself and my colleagues at RTI have really been delighted to work with World Obesity on this important issue. With them, we decided that we needed to develop a credible and comparable set of estimates of the economic impacts of obesity across countries, including both rich and poor. This has never been done before. But as you know well, obesity exists and is rising in all countries in the world. So we need to have this kind of evidence, this kind of data, both for advocates and policy decision makers in countries, but also for global decision makers, funders, donors, the people who get involved in trying to shape and change and improve people's lives around the world with evidence. So to oversee us, I definitely want to mention this right off the bat, to oversee our work and keep us on the right track, we invited a very esteemed set of obesity and health experts and researchers to guide us, and we call this our CUEG, our advisory committee on obesity. I can't remember exactly what CUEG stands for, even though I made it up, sorry. But these advisors are Franco Sassi from Imperial College London, Kelly Brownell from Duke University, Mira Shaker from the World Bank, and Tim Lobstein from World Obesity Federation. So I want to acknowledge their contributions. Now, next slide, please. I'm going to go ahead, and this slide is the nitty gritty, and I'm going to spend the rest of my time showing you results, but I wanted to start by showing you what we measured to help you understand and use these figures. So on this slide, you can see there's at the top boxes, direct costs and indirect costs. The direct ones are the tangible ones that everybody can experience and see, and they include medical costs, very importantly, and then non-medical costs such as traveling to and from clinics and medical appointments, and caregiver costs, because often people living with diseases that are that arise out of obesity and are related to obesity, they need care, they need support, sometimes from family members, sometimes from others. On the indirect side, we're measuring sort of less tangible costs. We're measuring early mortality or premature mortality, because unfortunately, some of these diseases lead directly to premature mortality. And we're measuring productivity losses for those who are in the workplace and working age. How do these diseases that are related to obesity and obesity itself affect their ability to work, absenteeism, presenteeism, so on? Next slide, please. So that's what we were measuring. And now on to the results. You can see that about 1/3, 36% of the overall economic impact that we measured is from those direct costs that I mentioned, the medical costs primarily, and then the non-medical costs. And then the roughly 2/3 are from those indirect costs, premature mortality by and large, and then productivity losses. Next slide, please. And so as you can see, the bottom line or the top line result here is that in 2019, the economic impacts of obesity are measured as 1.8% on average across these 8 countries. Now, these are 8 pilot countries. We're expanding the analysis now, but the paper that was published last week was based on the data from these 8 countries, different income levels, different geographic areas of the world that we wanted to include. And that GDP, gross domestic product, or economic impact, is expected to double by 2060. So big numbers in 2019, bigger numbers in the future. Next slide, please. So you can see across the countries, those 8 countries that we mentioned, these bubbles indicate the impact on GDP. That's the dollar amounts there, and then the percentage of GDP in 2019. And it ranges because of different conditions in the countries, different obesity and overweight prevalence, different capabilities of health systems to address the obesity and the diseases that are related, wage differences, employment differences, and demographic differences. So we looked at all of those things. Next slide, please. And here you see in 2060, the same bubbles with the numbers indicating the overall US dollar-based impact on GDP, and then the percentage of the GDP in that year that is expected to be lost due to obesity-related diseases. Next slide, please. And finally, at a per capita level, because that brings it all home, what does it mean per person? Well, these are pretty significant numbers. on an annual basis, they vary again across countries for reasons that I've mentioned, but on an annual basis, that people, and not only people living with obesity, but people in the entire country would be losing, if you will, because of the impacts of obesity. So I just want to end with a very important point that just as with other non-communicable diseases, and those that we included in this study are 28 different non-communicable diseases that are related in some proportion to obesity. We know that individuals living with obesity should not be held responsible for these economic impacts. That's not the point at all. There are many factors that play a role in obesity, but we want to understand the economic impacts so that we can make the point that addressing obesity and its related diseases earlier will save money for all of society and economies, and allow that money to be used for better and other purposes. So I'll stop there and look forward to the discussion. And I think I'll take some questions first. Thank you.
Great, thanks very much, Rachel. There are a couple of questions coming in. Adam McCormack is asking us, how we selected the countries, and whether we've chosen the right countries. For example, is South Africa really representative Africa? And I suppose a supplementary question to that is are we going to broaden this to include other countries in the future?
Yes, thank you. Thank you, Adam, for the question. So these countries aren't intended to be representative. They are 8 distinct and different countries. How did we choose them? As I mentioned, we wanted to have a range of different income levels and different geographies, but we also, as modelers and analysts, this is important to us, we wanted to have countries where there were already some estimates of the economic impacts of obesity that were published, that came from researchers in those countries and other researchers, in order to kind of compare and validate what we were doing with our modeling. Our modeling allows us to then expand to the rest of the world, which is what we're doing right now, and we expect we will be able to publish the global results in early 2022. So this is just the sort of the beginning of the story, but it's gives us a range of places and contexts in order to understand that it is of significant magnitude in all of these places. Thank you.
Thanks, Rachel. There's another question, which I think is another good one, from John Feeney, who's asking about whether we included the cost of comorbidities or complications of obesity. Otherwise, of course, the cost will be much higher. My understanding is we did include probably more complications than many other studies, but obviously not all the 250 complications of obesity that we know about.
Right, that's right. But we, as I mentioned, we included 28 obesity-related diseases, and that ranges from various cancers to cardiovascular diseases, musculoskeletal, some neurological, chronic kidney disease. So those with the largest health burden in terms of DALYs. There are many others, but that would be sort of relatively small what we left off. I think we captured the biggest stuff, by far the majority of the impacts.
Okay, another really important question is, and I guess this is about translation into policy, is how can we use these results to advocate for better treatment for people living with obesity?
Yes, thanks, John. Well, first I'll say it's almost essential to have results like this these days, because policymakers, particularly in ministries of finance, but also ministries of health, need these kinds of numbers and expect them. So as I work in different areas of global health, although always in NCDs, but I encounter people working, for instance, in undernutrition. I was on a webinar this morning. People were talking about undernutrition, in vaccines, in other areas of child health. People come armed with those numbers. They come with them and they say, look at the impact of these conditions on our economy and on individuals who sometimes have out-of-pocket costs that they have to pay, and it affects their poverty. So we need these numbers just to be in the dialogue. But secondly, as I mentioned earlier, if we understand the current impact and the potential impact, that changes the dialogue about what to do about it and the urgency of doing something about it, because we all know that prevention is cheaper. Yes, the gains don't happen often until a little later, but prevention is very important, and these numbers help mobilize energy for prevention.
Okay, I'm gonna try and merge the last sort of 3 questions that have come in here, because we are running out of time, and there are some great questions, but hopefully some of these will come up in the panel discussion that's to come. And these kind of relate again to the costs. So I guess one point is one is, have we included everything, or are there unmeasurable costs that we haven't included? And the other question relates to the fact that we've in the process of doing this work, we've put obesity and overweight together, and therefore, are we by doing that, are we actually overestimating costs, because we're conflating overweight, which of course is a substantial number of people with obesity, and obviously the severity of costs will tend to rise as the severity of obesity rises.
Well, let me see if I can handle the second question first, and then you're gonna have to remind me of the first one.
Yeah, sorry.
So we're not conflating. There are different costs associated with overweight and with obesity, but there are costs associated with both, particularly because both can lead to health challenges and different diseases. So we wanted to capture it all, and I think it's important to capture it all, even though we sometimes just talk about obesity in this case, and in our publication, we really mean overweight and obesity. So it's important to say that. John, remind me please of the first.
Yes, so the first question is whether we're underestimating some of the costs because we haven't included all of the complications and all.
Yeah, that's really important. And you're absolutely right. There are things that we did not include in here, such as sort of some of the emotional and mental stress that can occur when people have diseases and live with overweight or obesity. There may be impacts on access to employment. In some countries, there's evidence that access to employment and wages and even education can be affected by the presence of diseases or overweight and obesity. We don't have good data across countries. It varies, so we couldn't include that. We could only include data where we have comparable, reliable numbers across a large group of countries. But again, we feel that we've captured the vast majority of what's important. And then it's also important then to talk about the things that are excluded. So I'm glad you brought that up.
Okay, there is a whole series of questions that relate to why the costs might be slightly different from other published work, and I guess the methodology is different. What's been included is different. I suggest that we bring that into perhaps the panel discussion rather than try and answer it now, because we're already a couple of minutes over time. I just wanted to acknowledge those questions, and maybe Joanna and yourselves can perhaps help answer that during the panel discussion. So I'm going to bring this part to a close and hand over to Joanna Ralston, who's the CEO of World Obesity, to moderate that panel discussion. Thanks very much, Rachel.
Thank you so much, John, and thank you, Rachel, for that excellent presentation. Really fascinating, and a lot of really, really good questions in the chat that we will, and in the Q&A that we will aim to address, and would ask all of you to sort of be on ready to address those as well. But now it's my pleasure to really bring in people who are in a way the most in the front line of this report in terms of understanding at the country level the implications of this report, how it potentially could be useful, what are some of their how this may shape some of their advocacy, all in, I think, a larger context that's important as well, which is that there's a great deal, thankfully, of attention to obesity in various ways, and certainly we've experienced through COVID, but also from our perspective, working with the WHO, a lot of increased momentum around it, that we want to be able to use this data. As Rachel said, you can't really change policy without the economic data, but to make some real major strides in the coming year. So I'm going to introduce all of the panelists briefly, and then ask them to make brief interventions, and then we will have a discussion. So I'll start with Bruno Halpern, who is a member. Dr. Bruno Halpern is a member of the World Obesity Federation Board, and he is director of the Obesity Center at Hospital, I'm not going to try to speak Portuguese here, 9 de Julio to July, I guess, Sao Paulo. He's also associate editor of the Archives of Endocrinology and Metabolism, and is associated with the Brazilian Association of Obesity. Our next, we also have Dr. Santiago Gomez from Gashol Foundation, which is a foundation headquartered in Spain, but working globally on childhood obesity issues. He is a psychologist with a master's in health and community welfare and a member of the Spanish Society of Epidemiology. We also have Dr. Banshi Sabu from India. He is the chief diabetologist and chairman of Diabetes Care and Hormone Clinic at Ahmedabad and president of the All India Association for Advancing Research in Obesity. And Dr. Ricardo Luna is senior medical consultant on obesity at the Institute of Specialized Nutrition in Monterrey in Mexico, and founding president of Mexican Society of Obesity, SMO, president of Central American and Caribbean Federation of Obesity and Metabolism, and member of the Clinical Care at World Obesity Federation. And then last but very much not least, we have Sarah LeBrock, who is formerly director of Obesity K, now has just founded a new obesity charity in the UK, which we hope to hear more about, and has struggled with weight most of her life. So she truly understands what it's like to live with obesity. She's a passionate and very much a highly respected advocate and spokesperson for concerns of people living with obesity. So I would love to start to ask my panelists some questions. First of all, if we could start with you, Bruno, if you could tell us a little bit about sort of the implications of this work for your country, for Brazil, and what is your reaction? How do you see this being useful?
Thanks, Joanna. Thanks, John, for the opportunity to be here. Well, I was very surprised, let's say like that, with the results. I think it's a huge economic impact, and I think that the headlines of 2% of Brazilian GDP, the economic cost of obesity it's huge. And we, with the Brazilian Society of Obesity, ABESO, we're trying a lot in improving obesity care in health, in public health services. Brazil have a very big public health system. It's one of the biggest in the world, but we don't have any option for clinical treatment of obesity. We have, of course, bariatric surgery, but it goes to a very little percentage of patients, and we don't have even follow-up for bariatric surgery. So that's also a problem. Of course, we're talking a bit more about prevention here. I think that the main goal of the documents talk about opportunities in prevention, and we're doing good work in this with sugar taxes. We're working on that, and lots of other things that we maybe could improve in prevention. We know that we are little in literature about the best ways to prevent obesity. I think it's very, very interesting, the first phrases of the document. No country in the world have reduced its obesity incidence. So it's very strong to make us to have very strong efforts to walk on prevention. But I would like to talk about treatment as well, because of course the goal of obesity treatment is not necessarily to put patients on normal BMI of lower than 25, but it would be very important to have as well economic costs of how much we will save if people lose, let's say, 10% of the weight. I think that's also something that should be performed in the future. But I'm almost sure that we can work with this document with Brazilian Ministry of Health and so on to improve all those ideas on prevention and sugar taxes and so on.
Thanks, Bruno. I guess I want to just jump in and make one point that this is very much also about people with obesity being incorporated into the health system, which is incredibly important, because in one very oversimplified way, looking at one aspect of the cost, is that people with obesity rarely enter the health system until they have a comorbidity. If they were able to, and
it's very important as well that, as has been discussed, that we don't put the guilt on obesity. It's very easy to rephrase it and say, well, people with obesity have a very huge impact in economics. So the way it should be talked is very important, and we should be very careful about it.
Yeah. So just to say, this is very much also about management and obesity being even sort of recognized in primary care, so that people with obesity don't need to essentially lose years developing a comorbidity before they can get help. They can be understood to have a disease that's in need of attention and treatment as well. So it's very much about prevention and very much about management and treatment and the cost of not having adequate management and treatment as well as prevention. So our next, Santi, do you want to say a few words to us about how you see this working, particularly in the population that GASL targets in terms of children, and were there any surprises? I think, as we'd heard Bruno mention, some surprises.
Yes, thank you very much to the World Obesity Federation for inviting GASL Foundation to this webinar. I can brief the impact of this report in Spain with one word. It's useful for Spain, and especially for the work of advocacy that we are doing here in Spain as GASL Foundation. Also, I would like to highlight that only with a reduction of 5% of the prevalence of obesity, as highlights this report, can produce a significant impact in terms of economics. So the second concept that I would like to highlight is it's time to action. And in this sense, we are working from the GASL Foundation. Since 3 years ago, we were pursuing the commitment of the Spanish government to create a national plan to prevent childhood obesity. And right now we have just reached the commitment from the Prime Minister of the Spanish government. And right now it's a key tool, this report and the results and the scientific paper published in British Medical Journal Global Health, because with this information we can put more pressure in all the ministries of the Spain, that sometimes, as you know, inside a government can be different opinions about the importance of creating or not creating a national plan against childhood obesity. With this information, we can reach the commitment not only from the Prime Ministry, we think that we can reach the commitment of all the ministries and all the areas of the Spanish government. And not only this, also, as you know, in Spain, we have a politics division in regions, and also we are sharing this information and this report with all the presidents of these regions of Spain that also have a strong influence in terms of education and health systems, because health systems and education systems are managed not from the national government, are managed by the regional governments of Spain. So we are sending as an advocacy piece this report with all these decision makers to highlight the importance of taking care of childhood obesity.
Thank you very much. That was very helpful, and great to hear it's already being used. We'll speak more about that. Banshi Sabu, can you tell us from the India perspective, and we saw those huge numbers for a projected percentage of GDP. Tell us how you see this report potentially helping your work, which is so important in India.
So first of all, thanks for inviting me, and I first congratulate the World Obesity Federation for coming out with a very beautiful documents on economic impact, and it has really created a huge value. When I circulated this particular paper to our Indian Obesity Society Executive Committee members, and then to press, media, along with that, we had also given this to our Ministry of Health also. And this impact of economic impact on overweight and obesity, I think, was not very much estimated in our country. People are not still recognizing obesity as a disease, and we don't have many obesity clinics, dedicated obesity centers, neither in government hospital, and very few in the private setups. They are running some obesity clinic. One of the important reasons was that we are not treating them We don't have anything in therapy to treat the patients with obesity. Now, persons with obesity, again, the BMI range up to 25, 30, we call them overweight. And in Indian standard, it could be more than 27 also. But people don't recognize till they have become, morbidly obese, or when their, BMI becomes more than 35. So I think this economic impact of this paper will create a big noise. Now, for prevention of pediatric obesity is a big, area where if we work, probably we can really prevent the obesity. I was just thinking that increasing the sugar tax, will it really impact? Because sometimes government may increase the sugar tax, but people are not knowing that why they are increasing the tax on sugar. They just think because it may be a government policy. So if government is increasing the tax on sugar, they must also advertise simultaneously in media that why we are increasing the tax, like they are increasing the tax on tobacco products or on smoking, because they want someone to get addicted with smoking, or because smoking is injurious to health. Can we have a similar type of thing on sugar also, or sugary beverages also, when it is written on the label itself that it is injurious to the health? I mean, something like that. I have written along with this document to the ministry that something just to increase the tax on sugar may not give that much impact, but simultaneously we should also explain that why we are increasing the tax on sugar or sugary products. That's number one. And second, if we can put like a caution like that sugar and sugary products are injurious to health, the similar way when we are writing on the tobacco or any nicotine products or on cigarettes that it is injurious to health. Something like that, if we can create at a national level or even at international level, world obesity, I think it will have definitely impact.
Great,
but
thank you.
Can prevent it. Yes.
Thank you very much, and I think that speaks to the need to do pull multiple levers at the same time. That's how we're going to address obesity. Ricardo, would you like to tell us from a Mexican perspective your response to the study and the media release?
Yes, thank you very much, Joanna, and thank you, Professor George, for this great opportunity for Mexico and for SMO to share with you the first results of the press release sent to the media in Mexico last week in regarding the new pilot study of economic impact of obesity in our country. Obesity is a serious problem in Mexico, both in terms of health and economy. It is important to say that for SMO, the evidence demonstrated in this study is very significant to send a message to the different stakeholders in charge of taking definitive actions toward recognizing and addressing the roots of obesity, driving change towards the same narrative. According to the latest data, in our country, 75.2% of our adults have overweight or obesity. This is the reason why the media has a great interest in this issue. This chronic disease is the greatest health challenge in our country. The main media in Mexico received the press release last Thursday and generate positive results with more than 35 publications. This means that 5 million people in Mexico received this message. Some of the most important media that published this information in Mexico were EFE News Agency, the newspaper Milenio, Forbes magazine in its Mexico edition, Televisa, and the portal of journalist Lopez Doriga, one of the most important key opinion leaders in Mexican journalism. In addition, we had interviews on radio and TV programs. Regarding to the main headlines published in Mexican newspaper, this highlighted the following points. The economic impact of obesity in Mexico was 2.1% of GDP in 2019. If urgent action is not taken, the economic impact of obesity could grow in Mexico to 4.67 by 2060. It is necessary to recognize obesity as a chronic disease to avoid the high health costs in Mexico. And the result of this new pilot study conducted by World Obesity Federation and RTI International showed that Obesity in Mexico is not only a public health problem, but also an economic one.
Great, thank you very much, Ricardo. And now, Sarah, I would love to hear from you from the sort of the perspective of lived experience. And I'm sure you'll have plenty to say. I won't even say anymore. Please jump right in.
Thanks, Joanna. Yeah, I think it's really interesting because I think this study, shows some really interesting information around the economic impact of obesity. But what I suppose kind of worries me when we talk about the economic impact of obesity is that kind of blame game and the fact that, we know that globally there's a lot of pointing fingers of it's the individual's fault. They live with obesity and they need to do something about it. And when we talk about these huge amounts of figures and amounts of money that we can save by, reducing obesity, etc., you kind of, I get scared about how the media will pick this up and how they will use it as kind of as a weapon against people living with obesity and kind of push that blame back onto them and say, well, you need to do something because if you do, we can save so much more money and we can use it for things that like cancer that like they love to love, because that's far more important than obesity in their eyes. And it's that kind of scares me, I suppose, is around how this data will be used. However, I do see that it's very important in also getting people to act, like we say. So in the UK, for instance, we need to get the government to be listening and going, okay, so this is the impact. So what are we doing about it? Because actually right now, we're not doing enough. People aren't getting access to treatment. They're not getting access to services. They're not getting access to the support that they need. So we need to kind of frame it in a really sensitive way to ensure that we kind of don't make people living with obesity have that increase in the stigma and the kind of shame and blame that they have, but also kind of make it in a positive way that we get some actual traction by policies and the government in driving forward kind of things that we can do to make a difference to kind of help people living with obesity and get them access to the support and services that they deserve, really. So that was kind of my overall kind of take initially, was kind of a bit of like caution around, oh gosh, this could go really horribly wrong, but actually seeing how the language is so important here. Bruno touched upon it when he spoke about it earlier as well, around how we frame this and how we get this message across in a positive way so that the right messages come through. And I think that's what's important here. So yeah, that was kind of my thinking.
Great. Thank you very much, Sarah. That's really, really helpful and really important. And I'd like to now just generally open this up for questions to the panel. In general, I'd like to hear from others. How can you be sure, Bruno, in Brazil, that that we avoid this contributing to the stigma problem that we know is significant in Brazil? It's not the same in every country in the world, but in Brazil, there's been a real move towards sort of blaming the individuals. How can we get the most out of this information without spilling over into something that doesn't help people with obesity?
Well, that's a thought question, because we as societies, we can write and give this information in the right way, but we never know how media will understand the message and use this message. So we have to be, like looking around, we have to be vigilant to improve that, because it's very difficult. Sometimes we lose control of what is being released. I think it's very important in every message being very clear about this is not blaming the individual, this is looking in a universal way, but it's not easy. If someone has some ideas on how we can manage it, I think it will be useful for all countries when releasing the material.
Absolutely. Some of the pictures that we saw from the report publication were really, we saw great content in terms of the report, but then often what happens is the pictures themselves are chosen by somebody else and are clickbait, wanting to, grab people's attention. And so I guess the question is, Sarah, I'd ask you, what are the cost benefit of getting the word out, which if you drill down into the report is there, but when with sometimes stigmatizing imagery, it's something that we struggle with a lot, but other disease groups do too as well. I want to add, it's absolutely not limited to obesity at all. but more of a problem in obesity, I would say.
Yeah, I think this all comes down to, a lot of it comes down to education with the journalists. And I think, we have some great image banks available. However, they're not in the places where journalists get their images from. Mm-hmm. And I think that's where there is this disconnect. We can create amazing image banks on our individual patient organization sites, but if they're not, the journalists aren't going to go looking for them. They need to be where the journalists get their images from. And if they're not there, they're not going to be used. And I think fundamentally that's where we're going wrong. I think sometimes is that we can't just go, we need to get journalists to change. We need to, I suppose, work towards, this is how they work. They're normally on tight schedules. They might have written a brilliant article with great language, but they're just going to grab the first image that they can see. So for me, it's kind of like, let's start thinking outside the box a little bit and seeing how we can make things work with the people that we want to work with, I guess. And so it's aligning a bit more with them and seeing so that we can make it a bit more user-friendly, I guess.
And yeah, and often when we influence journalists, that's nice and well and good, but it's the editors who are really the important ones. So in terms of, part of the whole point of the study too is to go to get outside of talking to each other and talk to a wider audience, because it's ministers of health that need ministers of finance. And I think we heard some examples from all of you about that, about it's not, ministers of health know this is a challenge. They'd love more resources and tools, but they know they'd like more budget. This is in a way to reach the ever important ministries of finance. So Santi, how do you see that working in Spain? Do you see this being something, how might that work? What are ways that you need to try to protect the narrative while communicating in terms that people in the finance side of government in Spain would understand?
Yes, of course. For us, is this report is a key report to be shared with all the ministries, including the finance ministry. In fact, the commitment of the Spanish government is to create the national holistic plan to prevent childhood obesity from one institution, that is the High Commissioner Against Childhood Poverty, because it's an institution with capillarity, with the capacity to reach all the ministries of the government and fight against childhood obesity and childhood poverty at the same time. Also, I would like to highlight, to contribute to the previous discussion, that it's different when we are doing advocacy, at least in Spain, addressed to decision makers, that we are sharing certain information, and it's different when we have the intention of reaching or raising awareness, or when we are implementing health promotion interventions, that the language and the messages and the contents are completely different and are always focused on promoting healthy lifestyles, not talking about obesity. So I think that also right now, the organizations that we are working in specific countries, we have the responsibility to disseminate as much as we can this information within decision makers, but not always should be shared to the general audience. We should determine which information is to be shared with a general audience and which information is addressed more to decision makers. So yes, of course, we are going to use this information with the finance ministry, but also with other ministries of the national and regional governments of Spain.
And you're making an important point there, Santi, that we use different languages for different audiences at times, and that is part of how we can, we can ensure that we can limit some of those potential downsides. But I want to hear from Banshi. How do you see the different the involvement of different ministries in India around obesity? Do you see that there's recognition already, and how do you balance that, and how would this data be helpful in that way?
So at present, obesity is not recognized a disease in our country. That's a very, the fact which we should know. And we try to involve with Indian Association of Pediatrics under the Indian Obesity Society and Association Physician of India, along with Diabetic Society and Endocrine Society, to create obesity awareness, that recognize obesity is a disease. A campaign which we have started named is a ROAD, R-O-A-D, recognizing obesity is a disease. And we had given white paper also to ministry long back, but still it is not recognized. Neither in government hospital and private hospital we are running any obesity program or obesity prevention program. But I'm sure this type of paper which we are producing with World Obesity, and it is going in the press, media, and ministry, will definitely increase the awareness, and probably policymaker and from the medical association, because Indian Medical Association along with Indian Obesity Society working very hard that first foremost thing, and we should recognize obesity as a disease, and then to train healthcare professionals to understand more about the obesity and the treatment part. Probably that will change the future of obesity in our country.
Great, thank you. We had a couple of comments from Jimena Ramos Salas, who is with Obesity Canada, about sort of stigma and language, and certainly making sure the study to determine cost of obesity. Again, this study is about economic impact of obesity. I think that's very important that we keep using the word impact. And when people use cost, when journalists say cost, we say impact. And what it is it's an impact at the individual level of lived experience, and it's and then more widely at the population level as well. And that's also a really important piece of this. But we definitely want to make sure that there's not a sense of funds being diverted for better things. That one of the panelists had mentioned, that we absolutely agree with this. We have a question about COVID and the impact on of obesity on COVID complications and mortality, but also impact of COVID and lockdown on particularly, I think, childhood obesity. Would anyone like to speak to that particular point about how you have sort of seen this linked in? I might ask Rachel Nugent, I might put you on the spot and ask you if you want to say something about this as well.
Not a problem. I'll jump in briefly. Of course, we do know that obesity is certainly a risk factor for more severe COVID and admission into ICU and even death. And we have analyzed some of those results in a report that World Obesity has that we did together. I don't know whether it's yet on the website, and so I won't recall the numbers off the top of my head, but the hospital admissions, admission to ICU, severe cases are all double digits higher among people living with obesity and with underlying NCDs that are related to obesity. So it's quite, that adds costs, and that's one of the things that we measured. Medical costs that sometimes people have to pay themselves. So it's a very serious problem. And my concern is that we're not seeing the pandemic response community, whether it's called global health security or whether it's pandemic specific communities, we're not seeing them include obesity and underlying NCDs in their preparedness and their thinking about the future and in the funding that they are allocating to try to address this issue. And I find that really concerning, because people, they need help. There needs to be better surveillance, for instance, better information for people who are at higher risk, and better ability to bring medical care to them in whatever respect. So it's a very serious concern. There have been a number of good discussions about COVID and NCDs and the risk factors for NCDs, but those are, again, all within the communities that are already concerned about obesity and NCDs. I think we need to break out of that. Over.
Thank you very much. I think, did anyone have another comment about, so Bruno, did you want to say something about COVID or something else?
No, sorry. I have a question that I was thinking about it. My doubt is if we use the per capita cost of obesity, if this could have a negative impact, because people could think, well, I don't have obesity and I'm spending money on those who have obesity. So that's it's a true question. I'm not sure about it, but I think in a more negative way that only the GDP costs and so on. I don't know if someone wants
per capita is a tricky one.
Yeah.
I think we have to be very careful with how we use it, and again, impact, not cost about this, but very much the Jimena is, again, the co-chair of our working group on stigma, and points out that we very much need studies for a variety of reasons, including this in other countries outside of sort of North America and Europe, to better understand these. That's also one of the ways that this study can be really helpful, but looking at in particular the stigma issues and the potential cost of stigma. The other point that I made in a little LinkedIn piece that accompanying this is from a personal level. It's funny, Sarah said, oh, cancer gets all the attention. I've had cancer. I don't feel the benefits of that attention, whatever that might be. I've very much experienced stigma. And I've had MS for 30 years, and I've been lucky. I've been in remission for 20. But in the first 10 years, I expect the cost of fancy medications that I had access to because of being in a position of privilege were about $750,000. So that's a cost. And I think that is a cost that I feel very comfortable saying, it's great it existed, but that's another way. But also I spoke to the personal cost, which I know anybody with an NCD has experienced of discriminatory policies, of cost of care, things that are not covered, huge amounts of out-of-pocket expenses associated with having an illness. That's a reality. I probably have spent $1 million out of pocket in my life on those costs. So I think it's really important. We have to think about, it's tricky because it gets into what is GDP count, but this is essentially just a way to say this is having an impact. That wouldn't it be great if we could have, not have to go out to 2060 with these numbers. Sarah, you wanted to say something.
Yeah, I was just going to say, when I'm talking about cancer, I just mean around the empathy.
Yeah, I know what you mean. And you're right, absolutely.
It's about, people do seem to be more like supportive of people wanting to cure and help and save, whereas when it comes to obesity, it's very much finger pointing, blame, do it, sort it out yourself scenario. That's what I was meaning, nothing more than that. Yeah, no, I know that. And I think it's so much of it, this is about solidarity across NCDs as well, that we're all experiencing these challenges, and many of the things that we're talking about to improve health systems, to improve access to fantastic treatment, to improve access to healthier environments are things that would benefit all of us. And united we stand, I think is really important. John Wilding, you looked like you had a moment you wanted to say something, and I'd love to hear if you have a comment on this conversation, then I'm going to start to need to close this down.
Yeah, I'll just make a very brief comment. It really came out of the discussions around COVID, but I think the points are ones that are applicable generally as well. And the first thing is obviously, to echo what Rachel said, that we recognize that COVID is itself, that obesity is itself a risk factor for poor outcomes from COVID, but also the government responses to COVID, which effectively kind of changed people's environments in a rather enforced way, meant that many people, and particularly some people living with obesity, found it even more difficult to manage their own condition than they did anyway, because their physical activity was constrained, and the stresses and strains that come with being locked down. So we see a lot of reports and so on of lockdown weight gain. But what I would say in response to that is that what governments need to do, and to some extent that the UK government has recognised this, although the amount of money they've put into it is relatively modest, and said, yes, we do need to do something about this. We do need to spend more money on treatment, and we do need to recognise the environmental causes of obesity, the societal causes of obesity, and try and do something about it. I think we are only scratching the surface with the current response, but at least there has been a recognition that the government has a responsibility to do something to change the obesogenic environment. And I see that as positive, even though it is at the moment a drop in the ocean.
Great, thank you so much. That's great. So this is we are coming to the end of our session, and did any of our panelists want to say one last word or moment? I'd welcome. Any last moments? Okay, Rachel.
Yeah, just really quickly, I really enjoyed the discussion and benefited from hearing the views of people that are working on these issues in the countries, and would very much enjoy hearing more after this and ongoing about what's useful to them in talking to policymakers and the media and others to address this problem. I mean, you're the ones that really know what's going to matter, and we economists have lots of things we can study, but we want to study, I do anyway, what matters and what's going to be useful to you. So just want to say thank you for this discussion.
Absolutely. I want to thank our panelists have just been brilliant, along with Rachel as our speaker. Really, really thank you very much for your participation. And I think just as some summary points, obviously, there needs to be a commitment to the Roots framework, as many of you know. It's recognize obesity as a risk factor and a disease, obesity through the life course, obesity surveillance. T is for treatment, although I would say, actually, hearing people speak, it's also training. I think there's such a need for training and in understanding obesity in the health system, and S for systems. These are ways that we hope to get towards a resolution. We do want to again acknowledge that thanks to a variety of factors, COVID, but also these triple billion targets that Dr. Tedros had set out, that WHO is very much focused on obesity right now, which is great. And we've got very interesting new countries that we're hearing of who are calling for help and support, you know, ranging from, we've heard about today about Burkina Faso being very wanting to do much more, our Pacific Island colleagues wanting much more, as well as all the major countries, including the most populous countries with the highest numbers of people, you know, the Indias and Chinas and other countries like that. So it's an exciting and important time. We're looking to the World Obesity Day will be an important moment as well. But I think the other kind of observation about it is that that I think it's been, we've heard very much, this is really important data, and let's treat it as something of high value, but also something that can be misused in the wrong ways. And so let's, you know, we have guidance and guidelines. We also, again, I want to acknowledge, have wonderful image banks across many of our organizations. Our European group for people with obesity has just launched a new one. I think it's called ecobobesity.org is their website. We'll send it out afterwards. We've got great images that we can encourage journalists and policymakers to use to show respectful and more realistic, frankly, and positive images, so that we can, again, move beyond some of the stigma that not only is horrifying in terms of its impact on individuals, but also has held back, I think, greater political action. But we also know that we can't win this fight from the sidelines. We have to be in this game, and we sometimes have to have challenging conversations and moments, but we're all strong enough and committed enough that that's going to be something we can all do together. And I think this is another way that we can all see that this is a problem that is really, everybody is affected by it. Everybody has a role to play. And we all need to act, as some of our colleagues said. I do want to acknowledge also that that the work over the past 2 years has been supported through very unrestricted medical grants from Novo Nordisk, who have been a fantastic partner to Research Triangle Institute and ourselves. And we have really appreciated their partnership and their just generally understanding how valuable getting this information out into the world. The ECPO Image Bank, Cherie has just sent out, ecpomedia.org. Apologies, Cherie, that I didn't have that on the top of my head, top of my tongue. People around me are used to that, but thank you so much. A few more things. The article itself is at the link provided here. We have more interactive data, including around how to use these, you know, these figures in the Global Obesity Observatory at data.worldobesity.org. And the summary report you can find on our website as well, which essentially summarizes some of the findings. And for next steps, we will be, as Rachel noted, launching on all countries in 2022. And again, use these as tools that are useful in conversations with policymakers and with others, and use them, you know, wisely and respectfully, because I think we all know that this is really important, and that we want it to be as positive and productive as possible. So I think that really closes up today. And what was really an interesting and helpful session. I want to just say thank you to all of you who spoke, and all of you who gave fantastic questions. There are many questions we were not able to answer. I think to the extent those about technical questions about some of the economics and the data will be responded to separately, and we will try to respond to everybody's question if we can. And also just thank you to all of you for you know, providing your personal perspectives and experiences, as well as your professional views on this. This is such a shared and important challenge, and we're very, very excited to be working with all of you. So thanks so much. Thank you.
Yes, thanks very much, everybody, and thanks to all of our panelists and to Rachel particularly for speaking today. And thanks, Joanna, for chairing the discussion.
Thank you, John. Thanks.
Thank you.
Thanks, John. That was great.